Good morning. I'm Shawana Lasker. I'm a GP partner at King's Medical Centre in Buckhurst Hill, Essex, which is basically really in London. I've been thinking about doing group consultations for about the past 6 months. And then when COVID came along, I thought this would be an ideal opportunity to take this forward because patients weren't able to come to the surgery, and to do group consultation would be perfect. So I talked to Time for Care team, I talked to Rupa Joshi, and I talked to Georgina Craig, who literally on the same day that I spoke to her said there was a training evening in the afternoon, which luckily was my afternoon off. So I joined the training, which was absolutely brilliant. And I was able to get a lot of knowledge about this, about how video group consultations run. So since then, the Time for Care team have allowed us, have given us 5 sessions, 1 hour each, to help us kickstart the whole process. So they guided us through stepwise, and we decided to pick postnatal mums. This is an area I'm familiar with in my practice. I do all the antenatal checks, the postnatal checks, the baby checks in my practice, and it was something that was easy for me to approach, and I knew a lot of the mums already antenatally, and I know they would have happily joined the group. So I got hold on board with me. I tried to figure out who would be a good admin or healthcare assistant who would be able to help me out, and I was rapidly able to identify 2 such people, and they've really been on board with me since the beginning. They're both really enthusiastic. Neither of them had any idea of how these groups could run, but one had, because she's my admin, she's very techie, and she was able to send off all the emails. My healthcare assistant who used to be a receptionist is very good with patients, so she's my facilitator. So once we were able to sort out the technical aspect of how to send off the emails, how to get the consent, what the Time for Care team did really crucially on our third meeting is they did a dummy run for us, and it was like a safe space for myself, my healthcare assistant, and our admin team to run this in a miniature form over half an hour. So the same structure as a standard video group consultation, which runs for 1.5 hours, we did it over 30 minutes in 3 sections. So the first section was the introductions and getting the consent. The middle section was for when the clinician comes in, and the third section was where it's sort of summarized and wrapped up again by the facilitator. And we were able to figure out by doing this dummy run with the Time for Care team that where the difficulties were. They then suggested that we try this another dummy run with the team in the practice. So do it with all the partners, the trainees, the nurses, the practice manager, to do it as a bigger team to see if it worked. And we asked all the team members to pretend to be pregnant mums, but to be honest, they were a little bit naughty. They sort of went off tangents, but this is, real life, what happens. So eventually, last Tuesday, we did our first run with the postnatal mums. We had a total of 9 mums, and we also had the health visitor luckily join in, and it went really smoothly. There was a little technical hitch at the beginning. What we did is we decided to click on the start the meeting 1 hour before, just to make sure. Our admin realized that she wasn't able to mute the participants, and there was a problem with the computer. So just one tip is to make sure that you do log on personally before half an hour, 1 hour before, just to make sure the tech side is working. We then, so our first meeting went really smoothly. It's so good that we asked at the end of the first meeting to the ladies, would you be happy to have another session? And again, we had another session last week, and we'd always planned to do 2 such video group sessions with our antenatal mums. And we had 8 mums yesterday, of which 3 were new mums and 5 were mums from the last group who joined. And we're hoping, and we've left it with them, that they're happy to share their numbers, and they can then continue meeting up by themselves, and hopefully even enlarge the group by themselves. So overall, it's really satisfactory from the practice team point of view. We've had a word with the partners, and we've decided that we're going to take this forward in September with our pre-diabetic patients. And we also had our last session yesterday with the Time for Care team. And again, they're very they're very focused and made us think about what are the pitfalls, how we're going to improve things for next time, how we're going to identify patients. So in a sense, we've already got a plan now for our next meeting. And I won't be the clinician. It'll actually be our diabetic lead in the practice, James McLaughlin, who's going to take that place. And what's nice is that everybody feels enthusiastic about a different way of working. And each of the clinicians have found some area of expertise that they'd like to take forward with video group consultation. So overall, it's been a really positive experience. But I think the two main reasons are purely because the training we had with the VGC through Georgina Craig was amazing, and also having Time for Care, which is from the GP Forward View money, which is free. Yes, it does take long. It's 5 hours of a clinician's time and an admin's time and a health. But these two things was instrumental in getting us set up for to run these sessions. So yes,